Hello everyone, welcome to our YouTube channel Medico and You. Please like, share and subscribe. Our topic of discussion is female breast cancer. Female breast is a modified sweat gland that lies in the superficial fascia of the pectoral region and it extends from second to the sixth rib. This was a brief intro about where it is present. So basically, we are going to discuss about 9 points which will clear your mind regarding breast cancer, and these are the points we're going to talk about: anatomy, symptoms, warning, spread, risk factor, prevention, investigation, self-examination, and treatment. So I'll try to keep it as short as we can, like 5 to 7 minutes maybe. So first, we will talk about anatomy. Basically, on this side of the board, I have drawn a very simple diagram of breast. It shows milk glands, milk ducts, which carries milk from the glands to the nipple area. There is a reservoir, and the rest everything here is fat only. The red area shown is the muscular part of the breast, and the green area at the top is the lymph nodes. So now coming to the symptoms and the warning signs. The first and the most important symptom is the new lump in the breast, and it also includes the thickening or swelling. There may be irritation or dimpling of the skin, especially near the nipple area. It also includes redness, and there may be nipple discharge other than milk, usually blood in the case of carcinoma. So there are now 6 warning signs. I mean, if one of them is present, it should ring the bell. Number 1, it includes breast or chest pain, pain in the upper back or shoulder even, changes in breast shape, size and appearance, swelling or lump in the armpit. Basically, the armpit is the area where carcinoma spreads most easily because of the axillary nodes there. Red swollen breast can also be a very common sign. Change in the nipple sensitivity is another sign which usually women ignores at times. So now we'll talk about spread and risk factor. So basically everything present around the breast area is a potential site of the metastasis. It can also spread from one breast to the other. It can also go to the liver. It can get dropped to the pelvis region. It can go to the vertebrae, and from vertebrae it can go straight to the brain. So basically it can get very complicated if it's uncured, if it's untreated. If we talk about risk factors, there are primarily 3 very important risk factors, and the most important and the obvious one is being a woman, especially of age 50 or above, and plus the family history is very important. Nothing to worry about, ladies. There is a tip to prevent it. Keep your body weight in check, be physically fit, eat green vegetables, fruits, or whatever vegetable you get in your seasons. Avoid too much of alcohol. Don't smoke. I know it's trendy and cool, but still you don't have to smoke. Avoid birth control pills. Yes, you can go for the alternatives. You can go for condoms or the other sort of devices which they put into your vagina for birth control. Avoid postmenopausal hormones, very important, which again is something very common in the Western world. And breastfeeding. If we talk about the investigations, it primarily revolves around first breast examination, which we'll talk about in probably 30 seconds. Mammogram, breast ultrasound, biopsy, and MRI. Biopsy is basically done as a confirmatory test because that's how the histopathologists come into play. Now the second last and the very important topic, self-examination, which I guess every woman can do at their home. They just need to have the basic idea how their normal breast looks like. So basically, it all revolves around the one part which is called inspection. You need to inspect very carefully the symmetry of the breast and the nipple. You need to inspect the change in color of the skin and also note down if there is some retraction of the nipple, which is very common and very important. And if there is a discharge on squeezing from the nipple area, which is again very common in carcinoma especially. And lastly, palpate all four quadrants with the palm of your hand. So basically, you just need to note down if there is something unusual in your breast. And finally, coming to the treatment. Treatment is very simple because we don't have a lot of options in it. It's just either chemotherapy and with the use of some drugs like tamoxifen, letrozole, and anastrozole. So it's very simple as in a way that we don't have a lot of options.